Minutes count when you're talking about saving the life of a baby. The difference between being a normal, healthy baby and having a baby with handicaps comes down to just a few minutes often. And those minutes are precious. That time you can't get back. Not all hospitals are equipped to take care of children with specialized needs.
The best of all circumstances is when children can be cared for in their own communities. But when they can't, physicians will decide how they're going to get that child the care they need. And if that involves moving that child to UCSF, they'll discuss the very best means of transportation for that child. And to put a child into a ground transport might mean 8 hours or more on the road, which of course nobody would ever want to do.
At present time, patients have to come in by airplane, land at the airport, and then get ambulance transferred to the hospital. And anybody who lives in the Bay Area knows that ambulance transport, depending on traffic, could be anything from an extra 20 to 30 minutes. For the kinds of things I take care of, 20 or 30 minutes is the difference between life and death.
Center, this is Joe. ETA anywhere from 30 to 40 minutes depending on traffic.
Many of these children or babies or mothers have an enormous amount of technology attached to them during the transport. So they may well be on a mechanical respirator, have 3 or 4 high-risk infusions going to maintain their blood pressure or maintain their heart rate. And every time you try to move the very sick patient, you increase the risk. And so the combination of the speed of a helicopter transport and minimizing the number of transfers from one mode to another is a key to both safety and long-term outcome.
You know, in this case, it really is about saving lives, and it really is about, you know, someone like this who has the chance to grow up normally and grow up healthy. When he was born, it was very scary. You know, an hour after he was born, he started to have seizures, and they had to bring him up to UCSF right away to get a very special treatment. It's only been around for about a year, as I understand it, and UCSF is the only hospital in Northern California that provides this treatment. So they needed to get him there as soon as possible, and we were really concerned about him developing cerebral palsy or quadriplegia.
I'm actually a guitar player and a pianist, and play guitar in a band, and also do some solo stuff. And I've lived here in Potrero Hill for about 15 years. In Potrero Hill, I think there's a really strong neighborhood vibe. My feeling is that it's a great location for the hospital. It's a great thing to be adding to the neighborhood. Every day you bike down 3rd Street, it's always been this barren wasteland going down 3rd Street. And the UCSF campus, they've done a great job of filling in the area with trees and greenery. The further I looked into it, the more I learned about the program and the flight plans that were established and the outreach that was being done by UCSF. And it looked like they were really reaching out to the neighborhood to try and alleviate the concerns of the neighborhood.
Okay, thank you. Yeah, we'll need more growing.
You know, if it saves even one baby's life, I think it's worth it.
The City of San Francisco and UCSF extends its arms to the entire state. It opens its arms to the entire state and provides for the children of the entire state things that they can't get in their own town.
Personally, I can't imagine a children's hospital without a helicopter. It's almost unconscionable to me that if you've got the kind of specialized care that only a few places can provide, you must be able to get the patients here in time. If you can't get them here in time, there's no point.